welcome to another Ask Me Anything webinar presented to you by Medical Alley Starts. Today we are joined by Kip McCoy, the VP of the Innovation Studio at OSF HealthCare. Kip oversees the strategic relationships, but also the internal innovation. And I'll give Kip an opportunity to introduce himself a little bit more after the word from our sponsors.
Hi, my name is Paul Carlson. I'm a principal at CLA. CLA is a professional services firm that provides industry-focused outsourcing, audit, tax, wealth advisory, consulting, and digital services to healthcare and life science companies, including startups. We pride ourselves in working closely with entrepreneurs and business owners to help preserve capital, manage and mitigate financial risk, and achieve the future they envision. If you'd like to learn more about CLA, you can visit claconnect.com or contact me after the event. Medical Alley would also be glad to connect you, or you can find me on LinkedIn. Thank you.
Hi, my name is Morgan Evans, and I am the founder of Avio MedTech Consulting. We provide fractional services in the areas of quality, regulatory, and engineering to medtech startups. If you would like to learn more about Avio, we ask that you visit our website at www.aviomedtech.com or contact me after the event. Medical Alley would also be happy to put you in touch with us, or you can reach out on LinkedIn. Thank you.
Hi, my name is Ryan Johnson, and I'm a corporate healthcare attorney and shareholder at Frederickson and Byron. Frederickson is a full-service law firm based in Minneapolis with offices across the Midwest and in China and Mexico. We serve as legal counselors, business advisors, and strategic partners for many innovative life science and healthcare companies, ranging in size from the smallest startups, sometimes just a founder with an idea, some of the world's largest medtech and healthcare organizations. If you'd like to find out more about Frederickson, you can visit fredlaw.com or contact me after the webinar.
My name is Christian Corello, and I'm the head of strategic growth for Mobius Medical. We are an Australia-based contract research organization now with U.S. operations and headquarters in Minneapolis. Mobius Medical is not your typical CRO, and that's by design. In addition to world-class first-in-human and early-stage medical device clinical trials, we are our client's strategic business partner too. We offer direct access to a full suite of subject matter experts ranging from regulatory and commercialization guidance to business strategy and capital raise advice. And every one of our services are designed specifically for medical device startup and scale-up companies, just like you. If you'd like to find out more about Mobius Medical's unique CRO services, please contact me after the event or find me on LinkedIn. Additionally, our mutual friends at Medical Alley can always connect us. Thank you.
Thank you so much for joining us. It's been a while, and I certainly didn't do your work at OSF justice by the brief introduction at the beginning. So, if you wouldn't mind talking just a little bit more about your role and OSF's role.
Yeah, happy to do that. Before doing that, I do want to just thank Philip, you and the Medical Alley team. We've been kind of partners, I guess, with you guys, or at least working with you for a number of years from an OSF healthcare perspective, and it's been great. And Sharetronics was a company that you guys had introduced us to, that our ventures team recently invested in. It's a Minneapolis-based company, so that was a great connection. And I've been talking to Avio and to CLA on some other fronts as well, so I can say we've had some connections from that perspective. But I guess a little bit of background just on me personally. I spent about a decade in nonprofit economic development here in the Peoria area, and that's really where I got really connected into the startup community. And so some of the work that I do now is reflective of I guess, my passion from that perspective, and really wanting to help early stage companies and concepts and getting into some of that innovation. And it was in 2006, 2007, we helped build a 50,000 square foot incubator here in Peoria. And as companies started to move in, it was a big gap in terms of the early stage funding. And we did have a few known angel investors here in the Peoria area, but it was really through that gap that we started to put together plans to do a an angel investor group. And so I had the pleasure of working with a lot of early stage companies and investors here in the Peoria area back in 2009 to put together a group called Central Illinois Angels. In part, it was just wanted to be part of an acronym that was also CIA. So I would, have to tell people that I worked for the CIA, and I couldn't tell them what I did. But that group has gone on to fund about $20 million in over 30 companies, and had a nice exit this past summer with a company called Endotronics that started here in Peoria, but exited to Edwards Life Sciences here over the summer. I joined OSF in 2016, and really that was a few years after OSF really started to focus and have innovation as part of the strategy. I will say OSF, we've been in the community now for almost 150 years. So we're one of the stalwarts and legacy organizations of Peoria, and take pride in that as we've continued to branch out. At this point in time, we've got almost 20 hospitals that we have primarily in Illinois, with one small critical access hospital in the Upper Peninsula of Michigan. We do serve about 1.1 million patients, just over $4.5 billion in annual revenue that comes in through the organization. Peoria is still our headquarters, by far our largest footprint, and some of the things that different service areas that we focus on are oncology, cardiology, neurology, and pediatrics. We have a large children's hospital here, the biggest one between Chicago and St. Louis, and do a lot of work with the pediatric community. OSF is, like I said, kind of in probably a little over 10 years ago, really started focusing on innovation and starting to put together kind of the ecosystem and the resources for what that needs to be. First was really some on the outside in standpoint of looking for startups and early stage companies that we could introduce to the organization and try to lead and drive change from that perspective. And it was in 2015, 2016 when we launched OSF Ventures, which is now a $250 million balance sheet fund that is continuing to invest in companies, primarily Series A, Series B companies. And we've spent quite a bit of time over the years as well developing relationships with startups that, even if they're a little bit too early for our venture fund, we have a dedicated team internally who our discovery and validation team and our pilots team that works closely with those early stage companies to be able to really take kind of a white glove approach from a understanding that the technology, the value proposition that they offer, and then being able to work with our operational leaders to help those companies get up and running. And so sometimes that funnel for us works both ways, where we have companies that we've worked with and implement that then get funded by our ventures group, and companies that the ventures group invests in and finds that then become things that we test and pilot internally. So we're really just continuing to build that ecosystem, and our innovation studio that I lead and am a part of really started to take shape in kind of 2018 through 2021, and part of that was with the release of an intellectual property policy that's similar to what a lot of top research healthcare or leading health systems have, and universities, where if any of our mission partners or employees invent something in the course of their employment at OSF, there's an opportunity for them to share in royalty revenue that would result from the commercialization of that particular invention. Some of that stems from relationships that we've had with a number of university partners through endowed research programs, so that when we have co-developed intellectual property, both our OSF mission partners and the university faculty both have the opportunity to share what those royalty revenues would be. Our team went from originally 3 people back in 2018 when we first launched and trying to figure out what it is that we're going to do. So in addition to kind of servicing and enabling that intellectual property policy, we shifted into and have started to encompass open innovation within the organization. So what our team likes to say is that we're working to shepherd the concepts of our partners. So our partners are primarily internal folks that we work with into impactful solutions at OSF, kind of as that first customer and first use case, and then look for commercial opportunities potentially beyond that, but first and foremost, trying to understand and have the value here at the organization. So we've done a lot of frontline innovation challenges over the years. We've have open innovation. We have about 25,000 mission partners that are part of the organization. So anybody can submit an idea at any point in time. And what our team tries to do is equip those inventors and ideators with tools like the value prop canvas and some of the things that come through organizations like Strategizer to help them be able to be thoughtful about what the opportunity is and how that can make an impact to the organization.
Thank you. That's a terrific overview, and I really do think that you do a great job of taking the internal innovation and getting it out there. Maybe before we get into some of the other questions, could you describe just briefly your patient population? Because specifically from Innovation Studio's perspective, I would imagine that kind of affects which innovation you might be focusing on.
Sure, we have I would say, diverse patient population. Well, what being in central Illinois, we certainly have a large rural population that we're serving. So out of the nearly 20 hospitals that we have several that are critical access hospitals with small footprints, but really impactful to the communities that we serve. So a lot of what we look at and think about are how do we serve those particular patients. And then we've had a lot of work also as an organization and things that we look at from a social determinants perspective. And so there's a lot of work that's happened with our on-call digital health group and our digital innovation development team that's developing internal products that are focused on how we're serving the Medicaid population in a number of our markets. Some of that has come through some Medicaid innovation collaborative grant dollars that we've had, and that's really been on a track record of being able to serve those patients. So we have kind of a number of factors from that area as well. The other thing that we have this, we call it an internal ecosystem from an innovation standpoint. And as it relates to thinking about different communities that we serve as well, we have an awesome STEAM program that some of my colleagues run. And so part of our team can help build some of the web applications that introduce kids at a younger age into what potential healthcare careers could look like. So as we think about not only our patient population, but we're going to have to continue to serve those patients in those communities, and getting kids excited about careers in healthcare and what that can look like earlier on is something that has been a big focus for us. And it's been a lot of collaborative effort, but kudos to our team that has done a lot of that STEAM programming to be able to look at ways that we can engage kind of the next generation of healthcare providers, and even thinking about the roles that are not frontline clinicians. So we have a large analytics team that's doing data delivery and some engineers and a lot of positions that aren't necessarily on the front line providing care, but are integral to being able to deliver care from a healthcare system perspective. And so being thoughtful about how we introduce and get people familiar with those opportunities.
I love that you mentioned the STEAM program, because it's a long-term investment with, not an immediate payoff, but from a long-term perspective, it could be hugely beneficial, especially as a lot of, if not all of the health systems are encountering workforce shortages, excuse me. Since you touched on social determinants of health, I'll jump into one of the questions that I received just earlier today. There was a recent change with CMS at the beginning of 2024. Providers are required to assess 5 different social determinants of health, where previously it was voluntary. How has that affected your work, and with some of the startups and scale-ups that are focusing in this space? Is there a real business case for them, I guess?
I would say the business case is building for that. I've been on some calls, a few discussions here recently where that has been a primary topic of conversation. I would say from OSF standpoint, we've been building towards that for a while now. In 2016, that's when we really started to take a keen eye towards those social determinants. And so we did start working with a few outside organizations, startup companies, early stage companies, to help us better identify and understand what some of those patient populations are. We've now implemented doing screenings. We're using a couple of companies external, but now Epic, our EMR, has some of those capabilities. So we are screening our patient populations now to be able to have and understand that information. But we're also internally, as well as talking to some external companies as well, about how do we look at and think about the data that we have now, whether it's structured or unstructured, and being able to put together a picture of what a particular patient's social determinants are, and as it relates to their own health, and trying to look at ways that we can be more proactive and be more prescriptive from being able to solve what some of those social determinants issues are. So there's I guess it's some internal efforts that are going on from a IT build and things of that nature, talking to some external companies that can help supplement that. And then we're using Find Help through Epic to be able to make some of those connections from a social determinants standpoint. Now, I know there are I think it's G codes and Z codes that are out there now that we're working on and looking through. I will say that it hasn't been something that our team has specifically looked at, but I know our population health team, some in our performance improvement team, and others are looking at and working towards what our kind of approach is and how we're going to handle that.
Thank you. Going back to some of the initial questions, and there was one question in the Q&A related to the type of innovation that you are focusing on. Specifically, as it relates to the Innovation Studio, are you focusing mostly on patient solutions, or are you looking into B2B solutions as well?
I would say what we've looked at primarily are more in the B2B space, and some of the things that have that we've looked at and done are more on the administrative side, or how we're supporting those who are providing care, or even on the education and communication side. What we've the kind of the primary things we've looked at are from that standpoint, and some of it is more low-hanging fruit or opportunities that might reside outside of some of what might be needed from integration with the EMR, which gets to be a little bit more complicated from that standpoint. So we haven't done a lot on the patient-facing side. It's been things that are more in support or service of those providing care, and that the patient isn't necessarily seeing, or things from like an education or gamification, those types of scenarios. So, like, for instance, one of those that we developed that has now been licensed out is a web application that was built to help once a patient is identified as having an implantable medical device like a defibrillator or something like that, to then understand from a pre-surgical and within the when the patient will come in from surgery, what are the things that need to happen to be able to have a safe surgery? Do they need to turn the device off or on? What are the instructions for use that the anesthesiologists or those in the surgery suite need to know and understand to be able to make sure they have a successful surgery? So that web application that continues to get loaded with new devices, coupled with some of the standard operating procedures and things that were being done by a couple of our innovative nurses. We're able to drastically reduce the amount of cancellations in particular for those patients that have those implantable medical devices. That we could see that was around almost $2 million opportunity within our main hospital here in Peoria, that then allowed us to kind of build that application to be able to be made available to other hospitals within the system. So those are kind of more of the things that we're looking at and building. We are looking at now, which it's kind of in early stages of I'll call it more of a patient engagement and communication tool, as opposed to something that's going to be maybe from that standpoint, as opposed to something like in the patient room or something along those lines. We do have some other developments that other teams are working on that could have commercial application. That it's surfacing insights for the clinical team in a way that's getting them the right information at the right time, but in a way that's not intrusive. And so trying to test some of that out to see how well that can work.
Thank you. When we talk to different startup and scale-up companies, a lot of them are communicating their main value proposition as delivering savings for a health system or a provider, without perhaps mentioning that there is a cost of change associated on the provider side. It's probably a little bit easier for when you're developing innovation internally, but how do you think about the savings delivered versus the cost of change equation?
That is an awesome question, and I think one that gets probably undervalued or underappreciated. And I will say that we probably don't do a great job of always being able to bring in that cost of change and what that's going to look like, and the amount of time that it might take to make that happen. But it is something that we are very aware of and want to make sure that we're keeping top of mind. Is to your point, that you could have an incredible amount of savings, but unless you have, let's say, a champion, for instance, who is and oftentimes a clinical champion who can then be able to more fully explain or iterate exactly what the value is and how that person is using it. That's typically that critical factor. And usually, unless we can find that person, we know it's going to be an uphill battle, and that uphill battle is probably not, even though you may be able to see some of the savings, it just might be the right technology at the wrong time, and try to kind of circle back to what when the time might be appropriate. So we try to balance within the organization kind of a push-pull of what are the problems that we're hearing, what are the gaps that we start to hear from frontline mission partners, some of our operational clinical leaders, and look at ways that, is there something on the market or something that we can develop or pull together that's going to solve that problem. But on occasion, it can't be ignoring new or interesting solutions that we haven't been thinking about. It may be a problem that we don't know exists until we have something that surfaces, and we then have the opportunity to take that to some of our internal subject matter experts to then get some feedback on. But kind of to your original question, it can be hard to really get your hands around what the cost of change is going to be, from time and energy and effort. And oftentimes that could be one of the failure points on a lot. We do a fair number of pilots, and if that isn't really part of the equation, that can easily be a failure mode or a failure point from that standpoint.
It also brings up a question of, balancing the short-term interests versus the long-term interests. And if you hear any noises on my end in the background, I apologize for that, but there seems to be a massive rebuild going on in the office. So that's what's going on if you hear anything. Shifting gears a little bit, you're based in Peoria, we're based in the Twin Cities, both in the Midwest. Um, Occasionally we struggle with business attraction, and that's been one of our main focuses at Medical Alley to make sure that people are aware of the ecosystem that we have here and being champions for Medical Alley. What is your approach? How do you make sure that people know of OSF, that they want to approach you, that they want to work with you?
Yeah, that I think has been something that we've tried to intentionally build over the last um, almost 10 years or so. And a lot of that was building partnerships and relationships with a number of startup or early stage related organizations. So, I mean, folks like you that have been helpful in bringing opportunities to us, but we've been sponsors and partners at Matter in Chicago for a long time and participate in a number of their different programs. We do some mentoring with companies there, so that helps us keep connected. I would say probably on the national, even international stage, we've done tried to do a good job of communicating out a lot of what we do. So kind of kudos to our marketing team to be able to help us to do that and to be able to share a lot of the innovations and things that we've built over the years. And then I would say, I mean, our ventures team has been awesome. They've really built a strong and positive track record. They've got people that speak all over the world. One or two one of them was just in Europe not too long ago at a conference, and they've been. It's been a challenging time, I would say, the last 2-3 years between a lot of mergers that have happened in the health system world, coupled with financial challenges from a healthcare system standpoint coming out of the pandemic and still struggling with a lot of increases in costs and staff and a lot of issues that not everybody's been able to maintain. A lot of systems, or some systems, haven't been able to maintain some of that corporate venture capital that had been, I'd say, activated and grown in the late 2010s into the pandemic. And we've been able to continue to have that be a key component for us. And so from a early stage company standpoint, when people know where the money is at, they're going to come from that perspective. But I would say over the last decade, it's just been through a lot of different partnerships and hopefully positive experiences with early stage companies. We've partnered with Generator, that I know has a great footprint throughout all of the Midwest in terms of the programs that they offer. So we do sponsor the G Beta program here in Peoria, and then that's connected us to a lot of other companies and opportunities that they have. So I would say it's just, we've been trying to be very intentional about the way that we partner and find early stage companies from that standpoint, and being able to be kind of make sure everybody knows we've got a shingle out there and want to be a partner.
Well, and I'm sure your economic development background has been tremendously helpful in.
Yeah, I was going to say, the sounds of progress that are happening around you, are things, music to an economic developer's ears, improving wherever you're at.
Yeah. And just on a personal note, you've always been great about connecting with companies that we send your way. So how do you balance the curiosity and wanting to connect with innovative companies and wanting to learn more about your work their work with some of the other million priorities that you have on your table?
Uh, I really feel as though you never know when you're one connection away from something that's going to be some awesome serendipitous thing. And so I've asked a lot of people a lot of questions and spent uh, a lot of time with other people trying to learn things. And so at least me, I feel like I'm not taking hundreds of calls a week or anything like that. And uh, really, it's trying to be that good partner, but balancing with the companies and opportunities I talk to that it may not be a good thing, but what I want our team to do, and when we think about things internally, it's about getting a fast yes or a fast no. Like I don't want the slow maybes are difficult, and there's maybe people on the call that I've given unfortunately been slow maybes about, but it's like, patience from a healthcare system standpoint, things take time, and so if I can help a startup company, either say figure out maybe not directly through me, but through a contact I can make for them with our discovery and validation team or our ventures team, to get them to a quick yes or no of whether OSF is a good fit for them. That's great for us because we know right away, and then the company can know right away and be able to move on. But we're also looking for ways that we're never going to solve our problems by ourselves. And so there's a lot to be said for just the value of ideas and connecting and collaborating. So I hate to see some of those opportunities go by when you don't know what you might be able to do or build together, where the value of your ideas colliding and coming together can make something happen. So we've been trying to be more intentional as well about how we partner or think about ways that we come together, whether it's sometimes with early stage companies, but even with other health systems, and what types of consortiums and ways that we can build those collaborative relationships. So in terms of my priorities, there's a lot of internal things and things that need to get done, but if it's 15-30 minutes here and there throughout the week or every few weeks, that's a great opportunity for me to learn, to get feedback, to provide feedback, and I think it makes everybody better.
Yeah, if getting a fast no is obviously getting a fast yes is the single most useful thing that you can get, but there's a lot more no's, and getting to a no fast is tremendously helpful for entrepreneurs, for innovators, so that they know that they can focus their resources elsewhere. You mentioned working with other health systems, and there was no way that AI wasn't going to come up during this discussion, but also because you're actively working with 30 some odd other health systems at the national level on or around, or trying to figure out how to meaningfully and respectfully deliver or use AI to transform healthcare. Could you talk just a little bit about that initiative?
Sure. So we've been working with Avia, which is a group out of Chicago. A lot of healthcare systems are a part of that, and they've got a group that's come together on AI and generative AI, and we're also part of Valid AI, which is a national group of health systems as well. And so we've been trying to be thoughtful and intentional about what does that look like for OSF. And one of the first things that we did was roll out a communication and learning module to all of our mission partners to help them better understand what is AI, generative AI, how is it going to responsibly, how do you use that as part of your position within the healthcare system, and of course the incredible importance of no HIPAA information should ever go into one of those platforms. But we've got a group that's come together with some of our innovation team. We have an innovation fellow, Dr. Handler, Rupa Folger, who leads our digital innovation development team. They've been leads of that internally and working with our IT team, and thinking about sort of ways that we can gradually roll things out or find things that are going to be useful. So we've got some people who are using Copilot now on an internal basis. So not from a patient-facing perspective, but from a way that we can just be better stewards of the resources that we have to hopefully find ways that we can do our work more efficiently. There are some things that we're working on, probably not a surprise from like ambient listening perspective, ways that we can enable our clinicians to not spend so much time in the EMR, those sorts of things. And then there's within my team, we've got a group, that medical visualization group, that's working on sometimes communication related, building storyboards and ways that we can better disseminate information. And so AI has been a huge tool and mechanism for them in terms of being able to generate content and ideas and move through things much more quickly and efficiently than we have in the past. Now, except those are not necessarily, they're not going into making a decision or even with a person in the loop type of decision as well. Those are more communication types of things, but we are certainly continuing to look at how we can do that from as responsible as a position as possible for AI in general.
Thank you. We had a couple of similar questions come in, one related to AI, another one in the chat, not necessarily related to AI, but all of them asking about how do you go about evaluating the innovative solutions and innovative technologies? What are some of the key areas, I guess, that people should be mindful of when approaching you and quote unquote pitching you on a new product or a new solution?
Well, so specifically for startup companies, it's really being clear on what is the specific problem that's being solved and what gap is really being overcome by that solution. I don't know. I like there's never no such thing as there isn't competition. I mean, competition is the status quo. People just doing whatever it is that they're doing now. And so I think, to me, a lot of some of the IT related opportunities that we see talk a lot about. I mean, there's so much to do with data integration and being able to pull things together and how does it fit and work within the EMR and the clinician workflow, things of that nature. It's being able to kind of clearly articulate those sorts of things, if that's part of the opportunity. The other is to just be able to really clearly articulate what is the true value proposition in terms of what's it going to cost us to be able to implement the thing, and then what does it look like from that? How can we really understand what the return is? We work with some business analysts as well, and with our analytics team and others, to be able to we have access to a lot of information and can pull it together, but really need a clear picture on what are all the components that we need to understand. I mean, if we're the first healthcare system that you're approaching, then probably one of the key things is patience, as we try to figure things out together and what that might look like, and having an openness for being able to test something and learn something over a 3 to 6 month time frame. That might not be the amount of revenue a startup company is looking for, but a way for us to collectively validate, is there a there, or what is it that we're really trying to, what can we really partner together on?
I mean, even just getting an opportunity to do some sort of valuation, or sorry, to do some sort of validation with the health system is something that is incredibly helpful to a lot of the specifically earlier stage startups that may have not had the commercial or the pilot traction with providers and health systems. We have a couple of more specific questions in the chat, but I wanted to. It isn't Ask Me Anything after all, so I wanted to give people an opportunity to really ask anything. One of them is, can you provide your perspective on the critical access hospitals and how they provide care to their patients with the limited resources that hospitals can sometimes have in physician staff and in other areas?
See that one more time. Sorry, Philip.
Essentially, how do you balance the resources that might sometimes be limited when delivering when
Yeah.
delivering care in the critical access space?
I think one thing that's been able to help us is the fact that we are a large system, and so we can tap into I don't want to say like a central set of resources, but things that some of those hospitals might not have been able to do on their own. And what this I will say this is kind of ancillary to the question, but what we've been trying to do also in some of those with some of those critical access hospitals or in some of our rural areas, or even set up innovation hubs where those entities, hospitals can get connected back more specifically to some of our teams and do more to surface ideas and opportunities within their populations and within their employees or their mission partners, as we call them, and have access to resources that they wouldn't have had otherwise through our kind of central innovation team, whether that's if they've got an interesting idea that they want to pursue, but it needs some research behind it. We have endowed funds and through academic partners where we can structure something together to be able to maybe build something out. And the same from being able to access analytics, data, IT types of resources. So we have opportunities that come in that from our team or others and within kind of the broader scope of innovation, we can play a little bit of that concierge quarterback to be able to help them get to those resources internally within OSF that they might have had a harder time or not been able to figure out or navigate otherwise. And so we feel like it's that kind of that connectivity back to the core and the main entity that allows them to have some of those resources, and a lot of them can learn and partner together with each other too.
The concierge, the quarterback, or the platform approach just keeps coming up more and more in recent years, and it really seems that both health systems, VCs, and other organizations such as Medical Alley even are taking or being a lot more diligent and are investing a lot more resources to really support the innovative solutions and technologies that they support. We had a question come in about the jump engineering approach that you have taken in conjunction with the University of, I would imagine, Illinois. Who is that targeted towards, and could you just describe that briefly a little bit?
Yeah, so we have something called jump arches, which might have been what they were referring to. I'm not sure. We do have some engineers here that are biomedical, mechanical, but also have some computer science that have built a lot of trainers from our kind of going back to 10 or more years. We had kind of initial focus on simulation education. That's where a donor was most interested in at the time and kind of moved into these other areas. But in 2013, we did set up something called Jump Arches, which is a now $120 million endowed research program between OSF HealthCare and the University of Illinois. So it's with a philanthropist, OSF's foundation, and the University of Illinois' foundation. It's fully endowed now, and there's RFPs that are issued now every spring. And there's several $1 million that are available, and those RFPs have kind of specific areas of interest. They might be around rural health or neurology. During the pandemic, we did ones that were specific to ways that we could think about testing for COVID, or ways to think about how do we distribute vaccines more quickly, things of that nature. And then the purpose is really bringing together what the philanthropist had in mind was we can't solve our own problems. And so how do we bring what's available from an engineering research and other and now it's with the university, it's expanded to all different parts of the university, with any of the schools, including those related to computing, et cetera, vision areas, with our clinical and other folks here at OSF to bring the problems of healthcare to the resources that can be available at a university to try to build and look at what some of those opportunities are. So things that have, like, there's been a number of new things that have resulted from that. Some of them have been with one of our physicians, Brad Sutton at the University of Illinois, and Matt Bramlett here at OSF, that have really been around the VR landscape and doing a lot in being able to do auto segmentation of moving images from 2D to 3D. A lot of the pre-surgical planning now started off with pediatric cardiology cases, and now moving into oncology. We just about a year ago opened up a large cancer institute here on our main campus in Peoria. And so thinking about ways that we could leverage that same technology for how we treat our oncology patients, for those that are coming in for surgery. So those grants match specifically the university and OSF. It's I guess I'll say, unfortunately, it's not necessarily something that those outside of OSF can have access to. It's really set up to be something between the university and OSF. Now, occasionally there are service providers, others that we may need to plug gaps along the way.
Thank you. That's a really, really helpful overview. To conclude, as we're nearing the end of 2024, it's sometimes time to think about priorities for the next year. What are maybe some of the things that excite you about 2025? What are you looking forward to, both in terms of innovation or even personally, if you will?
Well, I'll start with innovation and kind of where we're at OSF, and even in the Peoria area. So I feel like our team over the last several years has built an awesome foundation, and we're starting to see some of the fruits where, I mean, it's no secret to people, even with a startup, it's a 8-year overnight success, right? You suddenly, everybody knows what you're doing. It's like, I've been doing this for 8 years, and whatever happened, something caught on and you found success. And so I think from an innovation and what our team is doing, it's been over the last several years that we've been building some of that foundation. Now we're starting to see some things that are launching and coming to fruition for what we've done. So I really see 2025 as that year to, we know what we don't know, and we're aligning the right partners, we feel like, along the way, that are going to help us from the early stage of development, from a commercialization standpoint, and really honing in on what does that kind of the engine look like and the way that we can be most successful from that standpoint. So we've learned a lot along the way and ready to kind of take it to, I guess I'll call it kind of the 2.0 standpoint. And so I think from an OSF perspective, we're continuing to invest in the community and investing in innovation. So I'm excited about that. From the Peoria standpoint, we opened up in July of this past year a new innovation and startup center just across from OSF's headquarters in downtown Peoria. And so I think we're going to see even more from a local startup ecosystem development, and lots of awesome things that are coming out from that standpoint. Personally, my oldest is now a freshman in college, so I guess
congratulations.
As a dad, getting through year one of freshman year in college is going to be awesome for me.
And a big change and a big adjustment. Well, Kip, thank you so much for joining us. I really appreciated your insights and really enjoyed the discussion.